And new tonight, a teenage boy in Nederland is the latest Southeast Texan to battle the coronavirus. Today, the city confirmed that boy between 10 and 15 years old has tested positive.
We know he's quarantined at home and is cooperating with health officials. It's not clear if he had underlying health conditions. He's the 14th person to test positive in the city of Nederland. This news comes as health officials in Beaumont warn that we have not flattened the curve yet. Good evening. I'm Dejanique Garrison.
And I'm Jordan Williams. We are also less than 48 hours away from Texas reopening. So there is a lot at stake, a lot happening. I want to get straight to three things you need to know tonight. Number one, Beaumont reported 5 new cases of coronavirus today, as well as another death. This now makes 16 fatalities just in the city, but 44 people have recovered. Number two, there have been more than 1 million confirmed cases of COVID-19 in the U.S., according to Johns Hopkins University. Nationally, more than 116,000 people have recovered. And number three, the latest models predict that Texas's mortality rates will shoot back up as the state reopens. One model forecasts a total of 1,657 deaths through August. That amount has nearly doubled in the past week.
Tonight, Texas is buzzing after a hint from Governor Greg Abbott. Alcohol to go from your favorite restaurant might not disappear when they reopen. The governor tweeting, "We may just let this keep going forever." 12 News reporter Tyler Segerman is live in Mid-County and talked to some business owners there.
Restaurants like Judice's 1927 in Nederland will begin reopening their dining room on Friday. In the meantime, they've been selling alcohol to go, which turns out has been a huge hit.
I would love it to continue. It just gives people something more.
Giving customers the option of ordering alcohol to go is something owner Al Judice wouldn't mind continuing.
It's something that's cool. It generates more revenue, you know. As long as people are responsible with it, I think it's an amazing thing.
Governor Abbott raised the to-go glass with a tweet Tuesday saying the service can continue when restaurants reopen and perhaps forever.
I think it's something that the state could get used to. Hopefully it's something they'll allow us to continue.
Thank you for calling, Judy.
David Nelson says it's a good way to support local businesses.
A lot of people, they'll drink at home anyway, and a lot of people don't know how to prepare the drinks that they can get out.
Others worry about drunk driving.
I'm afraid that, once they open them back up, they're going to go and celebrate a little too hard.
Nederland Police Chief Gary Porter shared these numbers with me. He says DWI arrests have gone down in Mid-County compared to this time last year. He warns all of the pandemic precautions won't matter in the long term if people don't make smart decisions.
We went to all this trouble to save lives. We've shut schools down, businesses. The least we could do if is be responsible for not drinking.
Back at Judice's, new alcohol sales are flowing, thanks in part to all of the crawfish.
Beer and hurricanes and margaritas go really well with that. So, like I said, we are seeing quite a bit of sales, but it's not like a bar or anything like that. But we are glad to have the revenue.
The Texas Alcohol Beverage Commission does require customers to purchase a food item with alcohol to go, and also all beverages must be served in a container. In Nederland, Tyler Segerman, 12 News.
All right, Tyler, thank you. New promise tonight about an experimental drug. It has proven effective against the coronavirus in a major U.S. government study that put it to a strict test. Dr. Anthony Fauci says the National Institute of Health has seen very positive early results with a drug originally developed to treat Ebola. It's called remdesivir. Dr. Fauci said patients treated with it had a 31% faster recovery rate than those patients that were given a placebo.
We think it's really opening the door to the fact that we now have the capability of treating, and I can guarantee you, as more people, more companies, more investigators get involved, it's going to get better and better.
President Trump echoed Dr. Fauci's optimism, saying the new study is very positive. However, experts caution these are early results and it's not a miracle cure, that is. They say there's still more testing needed.
Now let's get an update on today's numbers of COVID-19 in all of Southeast Texas. There are a total of 589 cases with 27 deaths. There's 330 active cases, but 232 people have recovered from the virus in the 8 Southeast Texas counties. And we've been telling you about one-day testing sites popping up all across the area. Well, there are 2 more to add to the list. In Orange County on May 5th from 9 in the morning till 4 p.m., people can get tested at the Convention and Expo Center. And in Port Arthur on May 6th from 9 a.m. to 4 p.m., people can get tested at the Bob Bauer Civic Center. Both these sites are by appointment only, so you have to call 409-550-2536 to set up an appointment.
All new tonight, you're going to get a few more weeks of relief if you're struggling to pay your rent. The Texas Supreme Court has extended the date on eviction trials and hearings until May 18th. That doesn't mean you won't get an eviction notice, but the court won't do anything about it until after May 18th. Also new here at 10, difficult decisions ahead for 1 in 5 Texas workers. That's how many are over the age of 65. The governor's Open Texas report tells them to stay home if possible. Erica Proffer investigates.
Chances are you or someone you love is 65 years old or older and needs to work. This Texas workforce report shows 21% of Texas workers fall into that group. It's more than 3 million people. But getting back to the office means going against Governor Greg Abbott's guidelines.
And most importantly, we strongly suggest if you're 65 and older, continue to stay at home.
Suggest, not mandate. We talked with Texas Workforce Commission's Executive Director Ed Cerna about choosing to stay home and its impact to your unemployment. Are they required to go back to work?
So high at-risk groups, we're going to categorize it as high at risk, not just the age category, but they're individuals with respiratory problems, other health problems that would be in that high risk. We're not going to cut their benefits off because they can't go back to work because they're in that category at this time.
But you may be replaced. Cerna says, generally speaking, if an employer needs to fill a position, and if they're following all guidelines, including the COVID-19 guidelines, and if you choose to stay home, the employer can fill that spot. But for those of you older than 40, TWC notes both federal and Texas law provide that age may not be a factor in any adverse employment decision against an employee.